to record this training so that we can have it available as a resource later. You'll also notice that we have an ASL interpretation from Juan and Genevieve, so thank you very much to both of them for providing that service today. Great. All right, so just as an overview of the agenda, I'm going to talk a little bit about who created this training. I'll give an overview of climate change and health equity, and then dive into the issue areas of heat, smoke, and power outages. So this training was developed in collaboration with the City of San Leandro Sustainability Office, the Alameda County Office of Sustainability, and the Alameda County Public Health Department. And the purpose really was to be able to educate folks on the populations that would be most vulnerable to different climate impacts that are happening over the summer, train them on the best practices that are available, and also provide resources and guidances from regional agencies such as the Public Health Division. Originally, this was designed for organizations, service providers, and staff in San Leandro, but since many of the public health guidance is regionally applicable and even statewide, we'd open it up to audiences more broadly in the Bay Area and across the state. So this is the third year that we are running this training, and all the materials that are available will be sent out in a follow-up email, including some of the links and the copy of the presentation. And overall, we're wanting to get more resilient and more adaptable to climate impacts, and particularly be able to train folks who are working with those vulnerable populations on how to better prepare and adapt to climate impacts. So just a little bit about my office here. I am with the Office of Sustainability in the City of San Leandro. I focus on climate resilience and equity, and we do a lot of work through our Climate Action Plan around addressing different climate impacts such as heat waves, wildfire smoke, and power outages. And here are just some of the photos that we have through our community outreach and workshops. And this is part of our Resilience Hubs training, so you'll see some of the folks there. So I just wanted to start off with some of the very key takeaways from this training. If you remember nothing else, hopefully you can remember these three things. First of all, we want to note that low-income individuals, communities of color, people with disabilities, all these are considered frontline communities that are going to be disproportionately impacted by climate change. And this happens through direct impacts from things like heat waves and wildfire smoke, as well as through indirect impacts through lack of access to resources or systems to be able to better prepare or recover from climate change. So today we'll be focusing specifically on heat waves and wildfire smoke and power outages, but know that many of these populations are impacted in other ways by other climate impacts as well. It's also important for individuals to understand the connection between climate change and health so that they can better protect themselves. And again, part of this training is to be able to help folks be able to identify what are the symptoms on a health level that are related to heat illness or related to smoke impacts, so that they can both help those populations that are working with, as well as provide information to them, and also be able to protect yourselves as well. In addition to that, it's also really important that we are providing up-to-date information during the event. So for community-based organizations, it's really important for them to know where to get that information. So, and as agency staff, we need to be able to understand how we're communicating, how we're distributing that information, so that those who are working directly with those populations can actually get access to that, so that we can better overall be prepared as a community. This slide here just shows a couple of the more recent headlines of different climate impacts that have happened in the past year. And unfortunately, every single year that we've done it, we've had more and more headlines to show. In the past year, we've not only had heat waves, power outages, we've also had atmospheric rivers, storm advisories, and so on. So this just shows that these types of climate impacts are here to stay. They're happening every year. They're getting more intense. They are having a real direct impact on people's lives, our workplaces, our day-to-day. And so this isn't something that's happening 10 years from now or the next generation, but this is something that we really need to be thinking about and changing the way that we do our daily business in order to adapt. Specifically for San Leandro, this is information that comes from our climate vulnerability assessment from our climate action plan. We know that extreme heat days above 89 degrees is expected to go from an average of 4 per year to over 20 days per year by 2050. We also know that the Bay Area regionally expected to see a 34% increase in the amount of area that's burned by wildfire, which will lead to an increase in the amount of smoke that is experienced. And you can see on the map on the right here, the area in red is where we experience the most wildfire risk. We're not going to touch on sea level rise and groundwater flooding today, but it is also noteworthy that as San Leandro is sitting along the bay, there is a large portion of San Leandro that is at risk for that permanent or temporary flooding. And you see that again on the map on the right, the areas in blue and the purple are where we have that sea level rise and groundwater flooding. So whose health are we talking about here? Who are those frontline communities? So as I mentioned before, folks with disabilities, low-income communities of color, people living alone, people who experience homelessness, older adults, children, all of these are types of different frontline communities that we're thinking of. They're experiencing both direct impacts to their health through the heat waves, through heat illness or smoke impacts, or kind of indirect impacts through lack of access to resources or structures to be able to recover. So for example, folks who are unhoused might not have access to a lot of those resources that somebody who is housed can get away from heat and so on. It's also important to note that many of these populations are in multiple of these categories. So for example, again, over 50% of folks who are unhoused are older, and many of them also are have disabilities, are LGBTQ, and so those types of vulnerabilities stack up, right? And so that creates multiple barriers that we as service providers, as agency staff, need to be thinking about as we are creating the policies to be addressing climate and also health. We need to be thinking of these communities really specifically as we develop these programs. Otherwise, we're not going to be able to address a lot of these equity issues and work and support the most vulnerable within our community. So I want to highlight a resource that's developed by the state. This is from the California Department of Public Health. They have per county a report focused specifically on the intersection of climate change and health. So they've developed a profile which is available online here. So if you're not in Alameda County, you can go online and search for the specific county that you're in. And the report includes a lot of different information. This is just one table that lists out the different climate impacts that are happening, gives a quick overview of the type of health impacts that could occur, and then the populations that are affected. And then again, today we'll be focusing on heat, smoke events, and power outages. So with that, we're going to transition and talk a little bit about heat and its impacts. So in Alameda County annually, we are going to be expecting an increase from 5 days of extreme heat to about 16 days by 2050. And this comes from the state database CalAdapt. And what's noteworthy about this is that not only are daytime temperatures increasing, but nighttime temperatures are increasing as well. And so what we used to have in terms of relief during the nighttime from the heat, we're not getting anymore. And that creates more opportunity for heat illness and so on to occur. This shows just a couple of really specific headlines around some of the events that have happened in the last couple of years. You see the numbers on the weather watch, some of the headlines here, as well as some of the mortalities. So heat death or mortalities related to heat illness is really, really serious. And heat illness is one of the most common ways that or most severe among kind of climate impacts that we want to be addressing. And it can be very, very sudden in terms of the transition from heat exhaustion to heat stroke and to mortality. And it's actually pretty preventable, but not very many people necessarily know the symptoms or what to look out for. So this training is really important to be able to highlight to folks exactly what to look out for, as well as some of the ways to prevent some of the heat illness and how to look out for each other. So some of the vulnerability factors in terms of the populations that are most impacted are listed here. People with pre-existing health conditions or medications that increase sensitivity to heat, low-income folks who are unable to adapt when we have both heat as well as kind of intersecting problems with power outages or smoke, elders, people who are unhoused, people who are living in homes without air conditioning, folks who are working outside, which include construction, landscaping, public works, agriculture workers, as well as people who are socially isolated without folks checking in on them. So some of these are fairly straightforward, right? If you're working outside or really having to live outside, then obviously you are more exposed to the heat. People who are socially isolated may not necessarily be immediately apparent to the general population, but many of the heat illness symptoms can cause loss of consciousness and kind of confusion. So if you are living alone or whatnot, it can be particularly dangerous, particularly if you already have other intersecting vulnerabilities, like being an elder or having those pre-existing health conditions. So the social isolation is something that we, again, as service providers, as agency staff, want to be thinking about, because while we can't change folks' pre-existing health conditions, we can provide ways to have, wellness checks and so on, other kind of social infrastructure, so that folks are not socially isolated. So just dive in a little bit deeper in terms of the older adults. Many older adults can have the pre-existing health conditions that increase sensitivity to heat. They also tend to sweat less. So some of the recommendations for what you do may not necessarily apply for them. They also can have difficulty staying hydrated and may also be less mobile. And then again, so they may have some of those other intersections in terms of isolation or not having the air conditioning. In the last big regional heat wave in the Bay Area, all of the deaths that were linked to the heat wave were folks who were born in the 1920s or 30s. So definitely this is a population that we want to be thinking about. So this is comes straight from the California Department of Public Health, and is a flyer that is translated into multiple languages. So I'll be sending this out in the follow-up email. It shows on the right here some of the symptoms for heat illness or heat exhaustion and heat stroke, and then also on a separate page talks about the recommendations for how to prevent the heat illness. So focusing on the right here, for heat illness, it's less intense than heat stroke, but is still a serious health threat. So some of the things that you want to be looking out for include headache, dizziness, heavy sweating, clammy skin, nausea, a fast, weak pulse, muscle cramps, loss of consciousness, or weakness. Heat stroke, on the other hand, is serious and potentially life-threatening. So some of the distinctions between that and heat exhaustion include not having any sweating, having a high body temperature, damp skin, a fast, strong, and a fast, strong pulse. So those are really important to be on the lookout for. When we're thinking about trying to prevent heat illness, not getting to that stage where you're already at heat exhaustion, checking in on neighbors and community members, particularly those who are living alone, is really, really key. And again, while we can't immediately change some of the structural infrastructure for the type of buildings that folks are living in, or their health condition, we can do wellness checks. And that is something that, as the service providers, as agent staffs, we can set up programs for that. So that is really key. We want to encourage folks to stay hydrated, staying in air conditioning as much as possible, especially when you're getting above the 90-degree temperatures. Wearing loose, lightweight clothing is also helpful. Again, we want to note that for elders, because they don't sweat quite as much, that isn't necessarily as helpful, but the other recommendations are still applicable. You can also choose to bathe or shower in cool water and put cool cloths on high temperature points like your neck, your hands, and your feet, and then generally avoid strenuous activity. Even if you are a really experienced or avid athlete or hiker or outdoors person, during high temperature days, it's really, really important to avoid all of that, because again, the onset to heat exhaustion or heat stroke is very, very quick. There was a case 2 years ago where a family that was fairly young, in their late 20s or 30s, went hiking, and they started early in the day when it was still cool, but because the temperatures peaked during the day, unfortunately, the whole family passed away as they were hiking. So it's really important to just keep an eye out on the temperature watch and avoid this type of activities. So I want to talk a little bit about type of resources that are available. So this is something that was developed by Alameda County. They have a resource for heat vulnerability mapping. So they've developed a vulnerability index which combines factors such as the built environment, tree canopy, impervious surfaces, as well as different demographic and health information. And this shows us where there's going to be more vulnerability around extreme heat days, and that link is available here. For folks outside of Alameda County, I think CalAdapt does have some information around this that could be used to develop something like this as well. Cooling centers is obviously something that local governments can help to provide. These are places where folks can get to for air conditioning and other kind of resources. All of the approved cooling centers can be found on the VOC website, and the link is provided here on the slide. As we are still potentially navigating COVID, the centers that comply with the COVID protocols will go live on the platform. And as different requirements change, as centers change their equipment and so on, some of the sites might shift. So there isn't necessarily one static list of places to go. So VOG is the best place to get the most updated information. And we recommend kind of checking that year after year or per event so that you're recommending the right places. Generally speaking, though, the best cooling centers are places where people already know because you're more likely to visit them. So, for example, if you open a new emergency shelter, but nobody knows about it, nobody goes there on a regular basis, they're probably not going to go there in an actual event of an emergency, be it an earthquake or you know, a heat wave. If you're a library that people go to more regularly, or a community center or faith center, you are probably able to function better as a cooling center because people already have that relationship with you. They know that you can provide these types of resources. So basically any safe air-conditioned space will be able to benefit a community during a heat wave. So for folks who are resilience hubs or thinking of becoming resilience hubs, this is something that we can collaborate with you on as local governments to be able to provide these kind of services to the community and be able to promote that. Trees is also another great resource. Not only will they be able to cool city streets by 2 to 4 degrees, but they also provide a whole host of other type of benefits from managing stormwater, reducing air pollution, reducing stress, and so on. So for those in San Leandro, you probably have heard of the wildfire grant that we have that provides funding for planting 5,000 trees. These are prioritized specifically for census tracts that are identified as low income or experiencing environmental pollution. So we're trying to address some of those structural issues and being able to reduce the temperatures in those areas. So if you're interested in talking more about how that's going, definitely feel free to connect with me afterwards on that. Or if you're in San Leandro and want to sign up for a tree, you can also go onto the link provided here. So now we're going to shift to wildfire smoke. So as most of you may already know, California has naturally a wildfire ecosystem, a landscape of that. Many of the trees, the plants, animals have adapted and evolved with fire, the event of fire. Many of the plants and the trees actually release their seeds after a fire event has happened. And so that is, and it's known by many of the indigenous folks here who did prescribed burns, who kind of oriented their communities around where the new fire zones existed and so on. So for many, many years in California, that was the way that things went. With the increase in industrialization and climate change, though, a lot of that has shifted. There's been more development in areas where there has been higher fire risk. And then with climate change, we see that temperatures are increasing, snow melt happens sooner, forests are experiencing drought, which causes them to be drier for longer. And that just creates this condition where you have really, really intense wildfires that would have occurred naturally, but now have been made more frequent and more intense by climate change. So this is just a illustration demonstrating that it shows in the 1970s that we really only had about 5 months across the state of wildfires. Can you still hear me, everybody?
Now we can.
Okay, great. Yeah, so as I was saying, the really big fires nowadays are happening up until Christmas time or New Year's because of kind of intersecting issues of climate, drought, industrialization, and so on. So that in itself is already a big problem. For the purpose of this presentation, though, I want to focus on the wildfire smoke. And this was actually a climate impact that we in the profession hadn't really anticipated until it started happening in the 2017 or so fires. And as you can see from here, this shows the index of what the intensity of wildfire smoke and air quality is. So you can see that, good air quality is green, and then hazardous goes up to 350 in the dark purple. On the map here on the right shows from the 2018 fires in Santa Rosa, the whole Bay Area was covered in really intense smoke. And this really became an issue because smoke can travel hundreds of miles very far away from where the fire actually occurred. So even though you might have a really localized effect from the fire itself, the smoke is affecting larger and larger areas and has these really bad health impacts, which I'll talk about in a bit. So a number of different folks are impacted by smoke. And these include folks with this diabetes, heart or lung disease, older adults who might be more likely to have these cardiac or respiratory conditions than the younger folks. Folks who are younger, on the other hand, are still developing their respiratory systems, and they're more likely to breathe more air per pound of body weight than adults, more likely to be outside, and they're more likely to have asthma in these days. So there's different set of conditions for those younger folks. Folks who are pregnant, there are a whole host of potential health effects for the parent as well as the developing fetus if they're breathing in the air. Folks who are living in older homes may have more leakage of that outdoor air into the home than if you are living in a new building. And then obviously if you are working or living outside, then you may just get more exposure to that smoke. So how does smoke affect you? The smoke contains a lot of different things. In the past, when we were only burning forest timber and so on, that was one type of particle. But now, particularly as we are seeing fires in more industrial areas, you get more toxic materials, plastics and cars and metals and so on. And the one particular particle that we in the field are kind of concerned about are fine particles, PM 2.5. And these are small enough that they will get into your bloodstream and stay in your respiratory system. And it causes a number of different issues ranging from asthma attacks, breathing problems, irritation of your throat, lungs, and eyes, worsening of your cardiac system, and also cumulatively causing premature death. So in addition to that, you can also experience higher risk of long-term effects. So again, if you are somebody with still developing respiratory systems, if you're younger or whatnot, continued exposure to the smoke will cause those kind of long-term problems. And those can occur even if you don't have sudden acute symptoms like coughing. And I can speak from personal experience as somebody who bikes everywhere. In the 2017 fires here in the Bay Area, I was pretty cavalier about biking outside. And then the next year, when we had the Santa Rosa fires in 2018, I immediately noticed a greater sensitivity to the smoke. And so just from that really anecdotal experience, I can say that there is that kind of a cumulative effect for smoke exposure and increased sensitivity, and also, just the body's reaction to the smoke. So it's really important then that we are communicating when these smoke events are happening, particularly because it may not necessarily be apparent from just going outside whether the smoke event is happening or not. In Alameda County, there's a system called AC Alert, which sends out a text message in English when there's an emergency, such as a smoke event, or in the case of earthquake and so on, that provides some instruction and resources to folks. Unfortunately, though, not all community members get that text message, either because of technological barriers, language barriers, or just distrust of government, not wanting to sign up for these things. So again, it's really important that we as local government build relationships with community-based organizations and service providers so that we can have them act as that really important bridge and information provider for communities. A lot of those audiences already have existing relationships with them. You're working with them to provide different types of services, whether you are a faith organization or a ethnic service provider or immigration service or whatnot. You are a trusted provider of information. And so when you can pass along information about smoke or heat or these types of climate impacts, you're then enabling us to reach a larger audience and enabling us to make sure that folks are just better prepared in these cases. So in Alameda County specifically, the county has developed out a community partners email list for community-based organizations to receive information when these types of events happen. So you can go onto the website listed here to find out a little bit more information about that. And we can also take questions about that specifically later on. So here I want to talk a little bit about the recommended actions. So depending on the level of smoke that happens, there's different types of recommendations. So in the yellow and orange category, folks who are more sensitive to the smoke, it's recommended that you're either going to limit your outdoor activity or just stay indoors. And again, we're looking at those with particularly the vulnerability factors there. When the smoke levels reach the red or the purple levels, everybody should be staying inside, or at least prolonging or limiting your prolonged outdoor activity. So generally speaking, the recommendation is to try to stay indoors as much as possible. When it is getting to that stage, you want to stay hydrated because smoke events are potentially happening at the same time as a heat event. And if you try to keep your indoor air clean. So this HEPA is one air purifier that can be used. You can also try to avoid burning candles, vacuuming, using a natural gas stove, fireplace, or tobacco. In terms of masks, the best mask to use in this situation is a fitted N95, P100, or KN95 mask. In these days, there is also the potential for having the smoke, COVID, and heat happen all at the same time. And the consideration there is that the ventilation for smoke and COVID is different. Outdoor air is often brought in to prevent more COVID spread. But that outdoor air is harmful in smoke conditions, and not all COVID masks protect against smoke. You can filter your air. So again, the HEPA air purifier or MERV 13 or higher filter for the HVAC system was generally the recommended filter for that. But generally, even if you don't have filtered air, staying indoors is the best way to reduce that smoke exposure. In addition to that, you also want folks to be able to stay cool, stay hydrated, watch out for the signs of heat illness. And potentially in some cases, in some areas, there's also a cleaner air center, kind of similar to the cooling center idea. These are public facilities that have air filters where people can get to and access clean indoor air in these cases. So now I'm going to shift to talking about power shutoffs or power outages. And this was, again, a new type of climate impact that started happening in 2019. So you may remember from those days that PG&E announced the emergence of the public safety power shutoffs or PSPS events in response to trying to reduce the amount of wildfires that are happening. It was found that some of those bigger wildfires were related to utility issues and lack of maintenance and so on. So they wanted to try and reduce some of those impacts by just turning off the fires and turning off the power in high fire zones. So the map you can see here lists where the high fire zones are. They have a tier 2 and a tier 3. You can also look on the map here. So some places here in the Bay Area do qualify as some of those high risk areas. So we do see these types of power outages happening in order to prevent fires in our region here. There are a number of different criteria for power PSPS events. There's no one single factor that determines this. So folks are just kind of trying to pay attention to what's happening. So they do include having low humidity levels, having high winds, looking at the fuel conditions on the ground and vegetation nearby if those are really, really dry and potentially going to set off the fire. If there's a red flag warning from the National Weather Service, and then relying on the ground observations from field staff. You see here on the map here, again, some of the higher risk areas for Alameda County specifically. Since the first couple waves of power safety shutoffs in 2019, PG&E has learned quite a lot and tried to put in some additional safety measures. These include undergrounding the power lines for improved safety, having enhanced power line safety settings. So I'll talk about in the next slide, trying to improve the vegetation component from falling on the power lines, having stronger poles and power lines to make it safer, and then also trying to have more precise targeted shutoffs so they're not impacting everybody here. In 2021, they started doing the enhanced power line safety setting, or EPSS. And you can see in the photo on the right kind of the depiction of what happens. Unlike the PSPS event, which is a planned event, the EPSS is an automatic setting that happens, that turns off the power when there's a hazard like a branch or some other object falling on the power line. The difference here is that this will prevent fires from happening from these unanticipated events, but also results in unanticipated power outages. So you kind of choose your impacts that are happening. So what exactly are those impacts from power outages? obviously, you lose power in your residential commercial neighborhoods. For folks who have younger children or elders, you're going to have to do a lot of changes to routines, and that can cause a lot of inconvenience and or loss of wages if you need to take time off to take care of those young ones or elders. They may be difficult to communicate because you've lost power for some of the power lines and so on. There's also risk for food spoilage if you have multiple days of power outages and loss of your refrigerator. And for folks who are depending on medical or mobility devices, it could be potentially life-threatening for folks. So the vulnerability factors obviously include folks who do depend on those electric, medical, or mobility devices. Folks who are indirectly impacted also include wheelchair users who live in those multi-story apartment buildings who then can't necessarily get out of their floor there. Folks who depend on having refrigerated medication needs like insulin will be affected. For low-income folks who can't afford to replace their groceries, this could be the difference between eating and not eating for the entire week. And for folks who are caretakers, again, this could be really disruptive and or cause loss of wages if you're not able to get out and manage your children and the elders when other facilities are closed, or if the business is closed itself. Low-income workers may also see a high disruption in their life and livelihood for that. So PG&E has developed a lot of programs to try and counter some of these. So I'm just going to go through some of those. They include a medical baseline program for folks who qualify, have the medical documentation. They will receive extra notifications in advance of the planned PSPS events. They may also receive a portable battery if you're income qualified. For those who do have a serious illness or condition but don't necessarily meet the qualification for medical baseline, they can also sign up as a quote unquote a vulnerable customer, who then also receive kind of the same kind of notifications and so on in the case of the PSPS. And then there is also a disability disaster access and resource program here in the Bay Area that is run through CRIL, and those participants will get backup batteries, hotel accommodations, accessible transportation, and food vouchers. And there's also a planning portal for the government partners to release some of that information. To continue on the resources from PG&E, there's also a food resource partnership to make sure that to try and get to some of those folks who are losing food based on the loss of refrigeration and so on. There's also a rebate program for getting generators and batteries. Again, if you're meeting the income level for that. And then particularly for us doing outreach, they also have a preparedness toolkit that is available in 13 different languages, hard copy and electronic, to be able to let folks know this is how to prepare in these situations. As well as a new safety action center, which folks can go on to themselves online. While all of these types of programs are really great and necessary, there are still gaps in support. And this is, again, where us as local government or service providers can meet some of that. Folks who are not on medical baseline but require additional help for refrigerated medication or other equipment as vulnerable customer status, there's still some infrastructure needed there. Accessing medical baseline status or vulnerable customer status might be difficult. Even if you qualify, getting all that information, navigating the portal, can be really difficult for folks who have low English skills or just don't have the type of capacity to navigate that. And then lastly, one of the barriers is that the PSPS portal is currently only available to local government agencies and not community health providers. Some of the best practices for individuals when the power shut-offs are happening is to make sure that medications are filled early, to have a lot of the durable food, have your own ice to cool food. Again, find buddies for those who are living their own. There's numbers for the hotline if there is something that's happening. As we get more and more electronic keys, it might be good to have a backup key or a manual key so you're not locked out anywhere. And then you want to make sure that you're avoiding surges for your large electronic appliances and having just flashlights or solar lanterns, battery lanterns on hand here. I also wanted to introduce a resource from the Bay Area Transformative Justice Collective. This is a way for folks to identify who is available for them to tap into for help in the case of emergency. So not necessarily even a climate-related one, but just overall emergencies. So this is a way to identify folks kind of in nearby. You want to have an out of town contact as well. You want to write out the emergency contact and just know who you can reach out to in the case of that emergency. There's also a link to the family emergency planning section in the county emergency pocket guide. So now we're kind of in the wrap-up period. I want to just go over some of the links for the different sections here. We have multilingual flyers for the heat and the health flyer. If you're in Alameda County or Contra Costa County, there's the emergency management text alert sign up. For wildfire smoke, Air Now is a really great way to find out where fires are happening and what the smoke condition might be. They also have from the county an FAQ document relating to the intersection of smoke, COVID, and health, as well as from the California Department of Public Health, as well as some guidance around how to make sure that you have clean air during wildfire. Here are just some of the PG&E links for the PSPS events. And want to point out again, there's a lot of information for the Disability Disaster Access Resource Program, and as well as the translated outreach material, which I'll send out the specific links to as well. So in the last couple minutes, 10 minutes for this training, I want to hear from all of you in the audience if there's anything that you do to serve community members before or during climate events, how you want to receive information, how do we get information to you, and if there's anything else that you want to see from these trainings that we can help to improve. You know, these are things that are happening year after year. This is the third year that we're doing this specific training, and it's not going away anytime soon. So we'd love to get some feedback on what else would be helpful and how we can better support all of us in protecting our communities. So love to open up the floor for discussion. Yes, Redwood.
Hey there, I'm Quinn Redwoods. I go by my last name. I'm the founder of Mask Oakland, which is a grassroots wildfire smoke response organization started in 2017. And I just wanted to say thanks for the presentation. When we started in 2017 and then in 2018 during the campfire, we distributed 85,000 masks in 12 days, all funded by social media and local groups and partnered with folks like CBE, and it was more than all Bay Area governments combined. And it felt really lonely, painfully lonely. Like we called different offices of, emergency and air hazards and air health and things like that. And they all said, like, what do you want us to do? So I think some of us are still just like processing that feeling of being abandoned, particularly our unhoused folks. So I just wanted to say I appreciate you offering this publicly so that I could find it and join, because it's a little bit healing just to see that like offices that you'd expect to be involved are like starting to be involved. And just wanted to share a couple of points of information that I think are good to add. Like for heat, we tell people who have housing to open all windows at night, to try to get their house matched to the lowest trough in the night when it's not smoke, like during heat extremes, just to try to reduce their house's temperature if they don't have AC, like a lot of us don't. And then for smoke, the Air Now is pretty generic, and you find a lot of people using an app called Purple Air, looking for more localized information. But we find that the app Air Visual is the best. It has 10-minute averages, whereas the Air Now map is doing like multi-hour averages. So it's really hard to kind of track what's going on. And then I guess the last thing I wanted to ask about is like, so there's, you mentioned all those vulnerable groups, particularly people who can't stay inside. And I think that's just always worth noting when there's all these recommendations about staying inside, that there's a lot of people who can't stay inside because they don't have anywhere to go. And then I know there's propagation of clean air centers happening now. There was a bill that was passed in, I think, 2021, and there's a lot of great stuff happening without accounting for healthcare for the homeless and other people. But I'm curious if you know about any mask distribution plans in the city to those vulnerable populations, and also if you know about any regulatory efforts for outdoor workers during smoke locally in the city of San Leandro. Thanks.
Yeah, great. Thank you. Yeah, also want to just give a shout out to you. Being one of the community organizer here in the Bay Area, Pass Oakland gives a really great example of mutual aid for all of us. So definitely want to lift up your efforts in organizing all those mass distributions, and also recognize that there should be a role in local government support in all of that, particularly knowing that these are events that are impacting all of our populations here. So definitely would love to follow up with you afterwards to chat more about how we can work together and so on. The question about mass distribution, I know here in San Leandro, our Human Services Department is the one that focuses most on supporting the in-house, and at least once, I'm not sure what happened during COVID, they were doing mass distribution during the smoky events. That might have changed, that there's been a lot of shifts in some of the resourcing and staff capacity and so on, but that is something that I think is top of mind for folks on how to better support the in-house and get not just housing to them, but also immediate relief during these types of events. So that might be one area to think about, what low-hanging fruit that we can get to for protecting the in-house there. And then I think your second question was regulatory policies. At least here in San Leandro, I don't know if we work on that level. I don't know if somebody at the county, Sierra, if you know of any efforts on outdoor workers.
I don't know of, thanks so much, Faye, and thanks for, thank you to you, Redwoods, for the question. I don't know of any efforts because I believe that worker protections are covered under OSHA, Cal OSHA, but there are a lot of efforts on those fronts. It wouldn't be housed at the county.
Right, thank you. I think one of the other difficulties too, just knowing that it is housed under OSHA, is that having the policy is one thing and then enforcing it is another. So there might also be kind of an initial step of making sure that employers are actually taking the steps to make sure that they're compliant with that. So again, there's a lot of different ways that we could be improving in terms of supporting our populations, again, as you noted, who can't necessarily reduce their exposure during these types of events. So yeah, we'd love to follow up with you afterwards in terms of brainstorming other ways to address those problems. Any other questions that you might have right now?
My name is Laura McCoy. I'm sorry, I'm losing my voice. I hope you can understand me. I live in District 7 in East Oakland, and I'm wondering, is there any contingency for addressing the very low income and disenfranchised peoples that live in those communities? Any outreach, special outreach efforts that you might have available? My organization does do outreach to those specific populations.
Yeah. I don't know if there's anybody from, say, Oakland here, or if somebody from the county wants to speak to that. I do know that City of Oakland does have a couple of different efforts around outreach through the resilience hubs, through some of their other specialized programs. And I'm not the expert on it, so I think it might be best to connect you with that direct staff member to try and see if they can answer it. So happy to follow up and send that introduction email to them after that. And then obviously, if you're working with Village Connect, they are a really great community-based organization that is doing a lot of really great work in trying to reach these different friendly communities and better support them. So again, if you want to be working closer with local government, we're at least my office anyway, is really eager to find more of these community-based organizations that we can partner with and collaborate. So there's a lot of different ideas that I have, at least in trying to work together.
Okay, thank you. And Redwoods, could you put your contact information in the chat, please? And
Sure.
I wanted to shout out to you for the work that you're doing.
Great. We are at 1 o'clock. I would be happy to answer any additional questions that folks have. So feel free to email me at sustainablesl@sanleandro.com. Or sorry, .org. If you have additional follow-up emails. There isn't a certificate for this particular training, but if you want me to write you an email and say that you attended this, you can feel free to email me, and I'll write something up for you. Yeah, also want to shout out Juan and Genevieve. Thank you so much for doing the ASL interpretation. And I thank everybody here for attending today. I'll send out a follow-up email with list of the different links, as well as a copy of these slides and the recording for your reference. And yeah, if you have any other feedback as we do another one next year, feel free to reach out to me. Thank you very much.